Most people are told knee arthritis happens because of wear and tear. But clinically, that explanation is incomplete and misleading. Knee arthritis is primarily an inflammatory biological process, not a mechanical problem alone. Inflammation is not swelling alone, it is a chemical signaling process inside the joint. Cells release inflammatory mediators known as cytokines that alter cartilage repair, bone metabolism, and pain signaling. This inflammation can be low grade, chronic, and silent. That is why x rays may look mild, but pain is severe. If arthritis were only wear and tear, all elderly people would have severe pain, athletes would all need knee replacements, rest alone would cure arthritis, but research shows cartilage loss accelerates after inflammation begins, not before. One of the strongest pain generators in knee arthritis is synovitis, inflammation of the joint lining. MRI studies consistently show that synovitis correlates more with pain than cartilage thickness. Many patients ask, Doctor, I'm not overweight. Why do I have arthritis? Because inflammation is also metabolic. Insulin resistance, visceral fat, gut inflammation, and aging immune dysregulation all amplify joint inflammation even in thin patients. Exercise and diet are important, but they are modulators, not cures. If inflammatory signaling inside the joint remains active, exercise may increase pain and diet alone may not reverse damage. Effective joint preservation must target inflammation, repair signaling cellular environment of the joint. This is why simply suppressing pain or replacing the joint is not the only path. Once you understand inflammation, fear reduces, confusion clears, and treatment decisions become logical. This channel exists to explain that biology step by step. If this is your first video on this channel, don't start with treatments, start with understanding. Watch the Start Here video first.